Many of our patients are under the misconception that as they pass through menopause and they're beyond childbearing, that their likelihood of developing breast cancer decreases. In reality, it's just the opposite. The older they get, the more likely they are to develop breast cancer. So they're never out of the woods, and they always need to be screened. Another common misconception is that if a woman has no family history, that they believe that they're not likely to develop breast cancer. While there are some genetic breast cancers, and we read a lot about that in the press, in reality, only 5 to 10% of breast cancers have a genetic basis. And so that means that 90% of the women have no prior significant family history, and they still develop breast cancer.
Breast cancer cuts a wide swath through the American population. 1 in every 8 women will develop breast cancer in her lifetime. And the risk increases with age. 95% of all breast cancer cases occur in women over 40. Heredity can be a factor, but it accounts for less than 10% of all cases. In recent years, the breast cancer mortality rate has declined. For most people at average risk, specific screenings should be done when you reach a certain age. Women should do a monthly breast self-exam combined with a regular clinical breast exam. They should have an annual mammogram once they reach 40. To detect uterine cancers, an annual Pap test and pelvic exam are recommended. For prostate cancer, most men should have an annual screening, including a PSA test and digital rectal exam after age 50. Screening for colon and rectal cancers is also advised for everyone over age 50. That's what's recommended for people at average risk. But for people at high risk, a different strategy is needed.